Hi, my name is Jessica Mary, and I'm presenting on behalf of Team 5. Our topic today is the 20th century U.S. healthcare system. For this presentation, we have two main objectives. One, to help the audience understand the values and the structural limits of the U.S.'s approach to the healthcare system. And two, to bring a greater understanding of the values and the structural limits of the U.S. political system and how these shape the legislative and policy choices we make in regards to healthcare. Americans value life, liberty, and the pursuit of happiness, and these values are seen and exercised in healthcare legislation. For example, economic security for workers and the belief of entitlement for the elderly have led to the largest healthcare reforms of our time, the Social Security Act, which includes both Medicare and Medicaid. Let's take a look at the timeline of healthcare legislation in the United States. In 1906, America saw the first proposals of national health insurance, and in 1915, proposals drafted were based on Western European models, but were rejected as being too socialistic. As America transitioned into the 1920s, we see the utilization of healthcare rise, and therefore cost rising due to citizens needing more hospital treatment. The on the Cost of Medical Care proposed a need for voluntary health insurance to cover the rising costs of medical care. During the Great Depression, President Roosevelt proposed the Social Security Act in order to provide economic security for poor and sick. After World War II, employee-based insurance began to emerge due to strong labor unions. However, since employee-based insurance did not include the disabled, elderly, or poor, healthcare reform would carry on into the 1960s, leading Medicare and Medicaid to be included into the Social Security Act in 1965. In 1974, the Employee Retirement Income Security Act, or ERISA, was passed to regulate employee-based insurance as a failing economy was putting increased pressure on employees and employer benefits. During the 1980s and 90s, the number of uninsured began to rise, and in 1992, President Clinton drafted the unsuccessful Health Security Bill to give more power to employee and commercial insurance industries. Towards the end of the 1980s, HIPAA was enacted to protect patients' personal information, which would then lead to the HITECH Act. What is Medicare? Medicare is part of the Social Security Act, and it is a health insurance program that assists certain groups who meet eligibility requirements. Medicare consists of 4 parts, which include Parts A, B, C, and D. Medicare eligibility is based on working for at least 10 years in a Medicare-covered employment. After that, the worker and the worker's spouse will be eligible for Medicare at age 65. In other cases, younger workers can be qualified if they have been obtaining disability insurance for approximately 2 years or have end-stage renal disease. In addition, it also reduces disparities by accessing quality care for all U.S. citizens who meet the criteria. Medicare Part A, or hospital insurance, covers inpatient services such as lab tests, surgeries, doctor visits, and supplies. Medicare Part B, also called supplementary medical insurance, covers medical supplies, x-rays, and home health services. Medicare Part C, or Medicare Advantage, which includes Part A and B of Medicare, refers to insurance coverage through private companies such as Preferred Provider Organizations, PPOs, and Health Maintenance Organizations, or HMOs. Medicare Part D was enacted in 2006 to provide prescription drug coverage. Medicare has unique opportunities and responsibility for reducing racial and ethnic health disparities, and has a responsibility to ensure that all those who have contributed to the program receive appropriate care on a fair and non-discriminatory basis. Medicare program management is broken up into different parts, with Part A, B, C, and D. Payment systems for Medicare have been moved into electronic claim payments. Fraud has been identified to be the leading cause of health expenses in the U.S., and the U.S. political system has taken actions to implement 5 powerful federal laws which regulate medical practices. The False Claims Act, the Anti-Kickback Statute, Physician Self-Referral Law, Social Security Act, and the U.S. Criminal Code are all used to address and detect fraud and abuse. Medicaid is a medical assistance program in which the state and federal government split the cost for eligible patients who cannot afford health care. It is enabled by the federal law Title 19 of the Social Security Act, and states have the option of cooperating by passing their own laws. Changes in Medicaid over the years have led to a growth of disbursements, with more patients benefiting from increased access, improved quality of care, certain benefits, and fewer limits. The beginnings of Medicaid began in 1950 when Congress approved federal aid that reimbursed states for some medical costs of recipients to the program, and would further develop in 1965 as a mixed federal-state program for certain eligible poor individuals. For Medicaid eligibility, individuals must meet state and federal requirements on residency, income, family size, immigration status, and citizenship. Enrollment is done through individual states. Medicaid provides for individuals age 65 or older, pregnant women, dependent children with low-income families, and the blind or permanently disabled. However, Medicaid cannot provide for all eligible individuals because of limited available funds. States choose the delivery of Medicaid. Fee-for-services is the standard, which pays care providers for each service, such as an office visit. And more states are moving towards managed care, where an organization under a contract with the state provides people with most or all of their Medicaid services. Integrating Care provides Medicare and Medicaid services through one service to provide higher quality care to dual eligible individuals. Employee-based health insurance was the first major type of widespread health coverage in the United States. In 1974, the first major federal law enacted to regulate employee-based health insurance passed was the Employee Retirement Income Security Act, or ERISA, which set minimum standards for many pension and health plans provided by employers and aimed to protect employees and their dependents. But in order to avoid ERISA federal mandates, many large corporations began to self-insure, and during the 1980s, corporations began to increasingly pass on the cost of health insurance onto employees. And in 1985, an important amendment made to ERISA, known as COBRA, allowed individuals to pay for employer-based health insurance for up to 18 months after losing a job. In 1987, employee-based health insurance peaked, and nearly 70% of the U.S.'s non-elderly population had health insurance either through their own or another person's employer. In 1993, the FMLA was passed and allowed employers to take up to a year off of work for family or medical reasons without having to worry about losing their job or insurance. The most current census data in 2010 shows that employer-based health insurance is in decline, which is due to the rising number of part-time employees in the workforce and increases in health insurance burdens on workers. The Health Insurance Portability Accountability Act, or HIPAA, was enacted in 1996 to regulate the misuse of patients' personal information and limit access to patients' records. Many medical professionals complain that HIPAA regulations inhibit the growth of future medical progress because of all the guidelines pertaining to patient privacy. The HITECH Act was enacted in February of 2009 to convert all medical records from paper to electronic. This act has enabled technology to improve HIPAA confidentiality by enabling more security measures to help keep patients' records private. Due to the HITECH Act, there have been decreased number of hospital errors due to the electronic record keeping. In conclusion, limitations such as opposing groups like the American Medical Association, interest groups, the free market economy, and opposition to socialism have shaped our legislation. After the Great Depression and World War II, social insurance emerged through the Social Security Act and employee-based insurance. Medicare and Medicaid provide the relief needed for these populations, but opposing groups would argue that healthy individuals should cover themselves by being employed. And throughout the 20th century, I have seen many obstacles in providing care to a growing population, and we can see how American values and political timing have shaped the U.S.'s healthcare policy and legislation.